Good. My name is Jeff Chan. I'm an associate professor of chemistry and I'm a member of the Cancer Center at Illinois. So the project that I'm going to be talking about is one that we recently finished where we developed an activatable molecule to target inflammation in cancer. The way that this molecule works is that it interacts with light in such a way that it can generate toxic species to be able to selectively kill cancer cells in the presence of healthy tissue. So it represents a new and exciting modality for cancer treatment.
So the concept of photodynamic therapy is very simple. So you have a molecule, a drug molecule, which is non-lethal, non-toxic in general. You inject that drug into the patient and it goes and accumulates in the tumor site. Now what you do is you shine light on your target areas such as a tumor, and in those areas the drug generates reactive molecular species. Now these reactive molecular species are toxic to cells, and by using light precisely at the target, we can generate these toxic species to kill the cells. In our case, it will be tumor. And one of the issues with PDT as a technique or as a therapeutic modality is that even though we can use light to spatiotemporally and precisely locate where we want to kill the cells, the problem with it is we are still not able to prevent the off-target toxicity of the nearby cells around.
So our way of targeting and studying cancer is using an approach called activity-based sensing. In a nutshell, what this type of technology entails is we develop chemicals that react selectively with a particular cancer biomarker in the presence of a sea of competing species. And in this case, we're selectively activating a molecule to interact with light to be able to kill cancer cells. So one of the really exciting avenues for this project is the disease biomarker that we selected. In particular, it is a small molecule called nitric oxide. This is one of the causes of chronic inflammation as well as acute inflammation throughout your body. I think there's a lot of really powerful and potent anti-cancer drugs that are available, but one of the major issues is that they're often one size fits all. So our approach and our vision is to utilize the chemistry and utilize the approach that we had just mentioned to be able to develop molecules that can be considered to be precision medicines. And when they're coupled with something such as a light source to trigger the toxicity, we believe that we're going to be able to really spare the patients from undue harm and be able to protect healthy tissue from unwanted damage.